Oh, hello, I would like to welcome people today to this Psychodynamic Pathways series. This is a series that ICAP is putting on its website with the aim of really to allow people to hear about how other people have sort of come to know about this way of working and how it's affected them in different sort of various clinical settings that the people have worked in. Today, I'm delighted to be able to introduce and to thank Brad Freeman for giving his time up to share his pathway to this way of working. Just to briefly introduce Brad, Brad's a senior clinical psychologist. He's spent most of his working career working with children, adolescents, couples and families. He's worked as a senior clinical psych in the public service, and also that's been in child and adolescent mental health services, the CAMS service, as well as having conducted about a lot of private practice for over 30 years. So Brad is massively experienced. Brad has a special interest in the fields of early childhood, couple and individual psychotherapy, and also reflective practice consultation to organisations, to groups. His current practice is in Hobart, Tasmania, where he offers supervision and psychotherapy. He's worked both in Sydney and Hobart. His personal interests, among other things, are writing fiction, poetry, walking in the Penangi region of Tasmania, and I'm pleased to say supporting progressive green politics. So without any further introduction from that, I will just start asking Brad a few of the ways he has sort of found his way working in this model. So Brad, if I could begin with the beginning, I guess, and ask you, how did you hear about and how did this pathway to working psychodynamically sort of come about?
Yeah, a pleasure to respond, Peter, and kind of notice what I find myself saying. I somehow came across Freud in a library when I was about 11.
Wow.
I think I was trying to find out about sex, actually, and somehow Freud came up. But I also wanted to find out about myself and relationships. And Freud was saying very interesting things to my 11-year-old self about what might be behind the appearance of what I was seeing around me.
Right.
And then in early adulthood, I was at uni and I had some friends who were doing analytic psychotherapies, and I thought, gee, I could use some of that for myself, and also I'd be really interested to have some of that experience. So I was sort of drawn to it. I remember when I first went to for a kind of assessment consultation with one of the senior analysts, and I sat in the waiting room, having hopped off my motorbike at the time, and I must have been there a bit early because I caught the end of the last session through the double doors that this analyst used, and there was some mumbling. I couldn't hear what was being said, and then there was just silence for maybe 5 minutes. And I thought, whoa, that's really interesting. I wonder what that could be. And then when I went into the assessment, I was talking about the house I lived in England that I loved very much. And she said to me, I think you're talking about your mother. and it really felt just so right. And I thought, oh, this is really an interesting, worthwhile, rewarding experience for me. I had to engage with it. And then I did a longish analytic psychotherapy.
Right.
And that sort of got me going.
Were you doing psychology at university at this time?
At that stage, I was I had an interest in mental health, and I was working as a volunteer in a R.D. Laing type supportive accommodation for people who had experienced severe mental health problems. Peter, I'm just going to have to interrupt just because the dog is barking and I will have to do
I'll just
something.
pause it, Brad. Okay.
Okay.
Right.
Yeah, so when I commenced therapy, I was actually at the beginnings of working as a mental health nurse at Roselle Hospital. And I completed that, worked as a community nurse, and in the process, towards the end of that nursing certificate, I also started psychology at uni and did that full-time for a while, as well as part-time, then did a postgraduate degree in Clin Psych, and yeah.
What did you, in that sort of training, did you get much exposure to sort of any psychodynamic sort of literature or thoughts?
Very little in the nursing, I'd have to say, although I was interested in beginning to think in this kind of way. But I was lucky that I was studying psych at Macquarie Uni at the time when Professor Ian Waterhouse, who was also an analyst, was head of department. One of the more rewarding bits of the course was that he ran the course in psychopathology and had us all, for our major essay, write about a dream either we had or someone else had from 3 different analytic perspectives.
Wow.
Yeah. And then his psychopathology course was quite analytically loaded.
Right. And the idea of becoming a psychotherapist yourself, was that brewing at this time?
Look, I think because of my interests, I kind of, yes, I think it was always there as a kind of internal calling, really.
Right.
That I responded to. And I subsequently worked with the child and adolescent team at Queenscliff, and that was very privileged to have draw on quite senior analysts as the supervisors for the course, analysts and psychotherapists, both child and adult. So I had regular case management style supervision with Bob Watton. Libby Dunn was one of my child supervisors. Bettina Ebert was another, and those supervisions went on for years. Ron Spielman was the adult supervisor, and those supervisions just continued for years, really. So I had very good experience in that way.
Did you go to the Queenscliff Centre because you knew that was there, or just you needed a job that came along with it?
Look, I knew that real therapy was being done in child and adolescent mental health, and that it really wasn't being done very much in adult mental health. So that's why I went there, not because I knew the supervision was available, but because I had a sense that it would kind of involve more of that kind of thinking.
Did you go through a period of, do I want to work with adults or do I work with children, or?
Look, the disadvantage of having done that and received the supervision in that kind of way is that I didn't really do that much formal psychotherapy study. I did my own reading, and we had reading groups, and I participated in some ICAP events and various things, but I never really fully quite put together a training package, although I was invited to be grandfathered in maybe 20 years ago to a couple of organizations, and then more latterly jumped through the various hoops to present papers and present my experience. And so now I'm a member of ICAP. I'm a member of CAFBA, the couples psychotherapy grouping, and I'm just completing some work to become a member of Newswhip.
Right, right. So, I mean, with all those different groups, do you find that, I mean, how have you used the psychodynamic models? What sort of, in terms of working with either couples or individual children or larger groups, do you find there's a common thing you're...
Absolutely, yeah. I mean, working in CAMS as long as I have, you have to be pretty flexible about how you deliver services. And so I've sometimes described what I do as being broadly eclectic on the outside and able to be problem-focused, presenting problem-focused. But on the inside, I have always had a sense of having a psychodynamic kind of map of what's going on, or tracking that.
And in that, I mean, are you eclectic in terms of you'll pinch a bit of sort of Winnicott, a bit of Klein, a bit of Freud, a bit of Bion? Or...
I think I see those, I see theory as a toolbox, and sometimes as a shed. And you know what it's like with sheds. You don't want to shut the door for too long because you don't get to see what's going on around you. And yet it's important to have some focused time where you're sitting with it and thinking through that lens. But I think my approach is a sort of a toolbox approach.
Right.
And I find different theoretical positions occur to me in the course of the sessions, depending on what's going on.
Yeah.
That being said, I don't consider myself in any way scholarly about my analytic reading or approach.
Right.
I enjoy reading analytically, but I like to read very broadly and then think about it from what I think is an analytic perspective.
So you wouldn't see yourself broadly in a school in that sense, a Kleinian, Winnicottian, whatever?
Look, I think not being English, not having had experience as a psychotherapist in an English training, I don't think I've been exposed to the schools in quite the same way, except through my supervisors.
Right.
Yeah.
Yeah, okay.
But the flip side of that is that because my interest has been early childhood and child studies, I think I have soaked up a fair degree of Klein along the way, but also some of the more applied observational frameworks. And because psychodynamic analytic thinking is not flavor of the month in psychology and in CAMS teams, I sometimes have recourse to attachment theory as a way of explaining myself when I need to.
I was going to ask that. I mean, being in CAMS for so long, do you feel this model has been attacked? Have you had to sort of hide it?
Both.
Right.
Maybe not. I've always felt respected in my work and supported as an individual doing the work and using that framework, and teams and managers and supervisees have drawn on it, and I've had room to do that.
Right. At
the same time, the atmosphere around me is not friendly to it, and there is a lot of pressure to achieve throughput, be efficient, be so-called evidence-based. Those kind of pressures are continually on a therapist in a CAMS team. And an awful lot of time is taken up with framing what you do and responding to those demands to kind of appear to work in that way.
Right, yeah, yeah. And looking back over your career, I mean, how do you feel you're working now compared to when you first started? How have you developed, or how has the thinking developed?
It certainly has. I feel more competent at one level as a therapist in responding to a wide range of presentations and ways of working with people. And also, I feel I'm very familiar with working with more than one person in the room.
Right.
And still thinking analytically. That being said, I feel like I know less now than I used to. Or it's available less there as knowledge, and I'm more interested in kind of finding out as we go. And I think I'm less interested in nailing it than in trying to find what's emerging or imminent and supporting that developing and unfolding. Finding the links and opening things up rather than achieving closure.
Right.
Yeah.
When you say nailing it, do you mean like giving a formal sort of closed interpretation?
I think so. Yeah. 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 And certainly, I mean, I think that's been a general movement within psychodynamic thinking.
Yeah.
And I've felt that inside myself. Yeah.
Does it feel very isolated in Tasmania? I mean, you're in a part of Australia, you know, that sort of history of sort of psychodynamic.
Oh, look, there's a kind of a handful of psychodynamically working people in Hobart. I don't have an enormous amount to do that with them. I have a very good friend and colleague, and we do peer supervision together, and he's English psychotherapy trained.
Right.
And I have a lot of colleagues in Sydney that I talk with and chat to.
Right.
Yeah.
Right.
So I don't really wouldn't describe it as isolated, no.
Right. And as you've gone along, have there been any particular papers or books or authors that have sort of you feel have significantly sort of you've been drawn to or have affected the way you work?
Look, early on, I discovered Marion Milner's On Not Being Able to Paint. My favourite analytic book. I've probably read it about 4 times, I think. I just love it.
Why? What's lovely about it?
Well, it's that notion of applied analytic thinking and applying it very broadly to life, right, in a way, and to art, and to just using the thinking to make sense of experience of the phenomenon. And she has such an interest in philosophy and thinking about the issues. That's what I really enjoy. That being said, I think my current interest is in, I've been reading Ferro more, Antonino Ferro, and enjoying his perspective about just thinking of what gets presented, no matter how concrete it seems, or how crisis-laden, or saturated with trauma and history, just keeping in mind that in the session, it's as if it's a dream and it's open to the ways of thinking about it that we can think about dreaming.
So you must find that in the canned work that really you are getting those sorts of cases presented to you, and you still find you can do that sort of not necessarily respond to the crisis immediately, and create some space to sort of think about it in a more sort of internal world way.
Definitely. I mean, I feel like some of the behavioral approaches and the techniques, they can be very helpful for people, and sometimes they're necessary to help clients have trust in the process and that you're giving them something concrete they can use. But I don't actually feel they're the levers that bring about the change. They're something for the client to get hold of, and that the change comes about with the insight and the thinking and the making links. But one of the things I was going to mention that was probably the most formative experience for me was actually my infant observation with Avril Earnshaw. I was very privileged. It went on for about 3 years, visiting weekly, and that mother and family, I actually think they did a therapy with me in a way, even though I wasn't responding, and I just got that really the primary thing is your capacity to contain. People will use that. That's where the movement comes, rather than what you feel like you're actually doing in terms of activity. And the challenge for me is not getting excited about the material and dropping too much into responding to it, but really keeping that witnessing, containing function going. That's what I experience.
Yes. Does that mean several people have said who they've got more experience, they generally talk less? You feel that's the case with you?
I try and do that.
You're allowed to. Another question would be, if someone was just starting out and was vaguely interested in this sort of way of working, what sort of advice would you give? They were thinking about being particularly a child and adolescent psychotherapist.
I think something about giving yourself permission to experiment and explore, and of course, to have the support of good quality supervision, consultation to help you explore and open up pathways.
Yeah.
And I think in a way, some of my best teachers have been kids that I've seen, because they require you to simultaneously think and be involved.
Right.
You and I have a theme in discussion about the significance of play.
Yeah.
And the importance of being involved with the play.
Yes.
And the way in which children insist on that happening. So I've always had a sense of that balance to be struck between sitting back in your own mind and putting things together and making sense of them and allowing reverie to occur, and demonstrating a degree of involvement and participation.
Right. Yeah. Just, I guess, to finish it up, the future of this sort of model and this way of working, do you feel pessimistic, optimistic? What?
Well, look, I feel very optimistic about the future of analytic thinking. I think now the psychodynamic community has had to embrace the mettle of demonstrating evidence, and the evidence is certainly there when people actually do something with the scientific rigor.
Right.
And I think the Shedler material particularly stands out. But I noticed that even the American Psychological Association now, in their policy papers, absolutely underline the importance of the conduct of the relationship as the most significant lever that we have.
Right.
And I think that's at the core of analytic thinking, is what's happening in the relationship.
Yeah. Do you worry about young people, how they even can begin to be exposed to this sort of dynamic, given they come mainly through the university system?
Well, the university system is not, the university psychology programs are not friendly to psychodynamic thinking at all. And particularly in Tasmania, it's very CBT and behavioural, with very, very prescriptive ways of working. And when I get younger supervisees, the thing that it's always an amazing surprise to them when I say, well, what's going on in the relationship with you? How are you being seen?
Right.
And psychologists are taught within university to teach their clients as if it's an educational process,
right,
rather than a process of discovery and learning. The emphasis is on the teaching rather than the learning.
Right.
And I think that's a very unfortunate thing that's come about. I think it is in the process of being corrected. The other thing I wanted to say, and you mentioned with some hurrah about green politics, is I've re-engaged with Melanie Klein because it's such a fabulous model of what needs to happen in the world for us as a culture to start entering the depressive position in our relationship with the world rather than ruthless exploitation from a paranoid, schizoid kind of perspective. And so I'm very interested in watching how that gets applied and how we might feed it into the culture.
Right. That's a fascinating link. I've never thought about that before. So,
yeah.
Thank you, Brad. Look, it's wonderful to hear how you came to this, and also to share your knowledge and experience, particularly in the CAMS area. And I think it's extraordinary that you've been able to maintain that model. You know, when you say generally around you, you've been swimming upstream in that way, or it's been very, very difficult. So you are always articulate and thoughtful about this. And again, I want to thank you for being involved in this series.
My pleasure, Peter.
Thank you, Brad.
Yeah. All the best.
Bye.
Bye-bye.